Multiple sclerosis is a chronic disease in the central nervous system. It was recognized as a condition in the mid-19th century, and its features were first defined by Jean-Martin Charcot in 1868. In patients with MS, their body's immune system mistakenly attacks myelin sheath, which acts as a protective covering for nerve fibers. This causes miscommunications between the brain and body. There are 4 main forms of multiple sclerosis, and they all differ depending on their course. Progressive relapsing MS, secondary progressive MS, primary progressive MS, and relapsing remitting MS. Cellularly, B cells and T cells mistakenly cross over the blood-brain barrier and begin attacking the body's immune system, which in turn causes inflammation and damage to occur around the nerves. As of now, there is currently no cure for multiple sclerosis. However, there are various therapeutic options to help manage the symptoms that come with it. One therapeutic option is B-cell therapy. B cells are an important target because they are a source of differentiating plasma cells that are known to secrete autoreactive antibodies that are contributing to the demyelination in the central nervous system. B cells normally don't cross over the blood-brain barrier. However, in the case of individuals with MS, some B cells do cross over and begin to attack myelin. There are currently 4 different types of B-cell therapies available to individuals suffering from multiple sclerosis. The first type of therapy is called ocrelizumab, which sticks to B cells and prevents them from causing damage. It is provided through an IV in a hospital or clinic, and the first dose is given in 2 infusions. The infusions are spread 2 weeks apart, and after that, infusions take place every 6 months. Ofatumumab is another therapeutic option. It is a human-made protein that attaches to B cells and weakens them, thus preventing them from causing damage. It is distributed in a pre-filled auto-injector pen, which is injected into the individual's stomach or thigh. The therapy begins with 1 shot a week for 3 weeks and then gradually limits to 1 shot each month. Ublituximab-Shi, an anti-CD20 monoclonal antibody, is another form of infusion lasting 4 hours. The first dose is followed by a second larger infusion 2 weeks later. The third infusion takes place 24 weeks after the first infusion, and other infusions following the first should only last an hour. Lastly, rituximab is an antibody that targets an inflammation-causing protein on the surface of B cells. It is a medication distributed through IV consisting of 2 doses, 2 weeks apart. Following that, every 6 months there is another round of doses. Prior to starting any of these therapies, it is important to rule out other possible infections via blood tests. It is also highly discouraged to undergo these therapies while pregnant, as it may cause harm to the mother and baby. The side effects for all 4 types of B-cell therapies are relatively similar across them all. The most common symptoms consist of infections, fever, swelling, and chills. More specifically, in all types of B-cell therapies, the most dangerous complication is what's known as PML, progressive multifocal leukoencephalopathy. PML is a rare but serious brain infection that is a possible complication of B-cell therapy caused by the JC virus. It is thought to be found in MS patients as a result of disease-modifying drugs used as a therapeutic option to relieve symptoms. B-cell therapy is very costly depending on insurance and how much it covers, so it really varies depending on location. The estimated cost of FDA-approved options such as ofatumumab and ocrelizumab are roughly $60,000–$80,000 yearly, whereas rituximab is a cheaper over-the-counter option and is roughly $5,000–$6,000. For individuals who don't have access to extensive therapies, it is recommended to make minor adjustments to everyday life as a means of improving quality of life. This may include things such as exercising, staying hydrated, and improving your sleep schedule. Overall, multiple sclerosis is a very debilitating neurodegenerative disease with currently no cure. There are many upcoming options to help individuals manage this disease, such as B-cell therapy, which can hopefully provide a sense of hope for their future.